Today I want to talk to you about whether or not we can help you once you've had a surgery to your spine. I'm Dr. Gregg Gerstin. I'm a chiropractor, and I've been helping people to remove the blockages in their health for the last 20 years to lead amazing, fantastic lives, and I want to guide you on that too. Many people who watch our channel have had problems with conditions in the past, and their medical doctors have guided and recommended for them to have spinal surgery. And they want to know, can I wind up coming to you? Can you potentially help me? Now, spinal surgery is really complicated, and what we wind up knowing is that when our surgical colleagues wind up helping to restore a fused segment, let's say they're putting two segments together in a certain position, there is an exceptionally higher success rate in terms of long-term outcomes. What's really interesting is that they look to target the same angles and positions that we help people to get restored to without surgery. So if you're considering surgery, you got to watch this video, and we've got to get connected so that we can figure out, can that be changed without the surgery so that you can have an amazing, fantastic life. If you've already had a surgery, can you wind up working with a corrective chiropractor to take care of problems that's shown up afterwards? You know, about 50% of spine surgeries wind up having lack of success or symptoms within 6 months to a year afterwards. And we've helped many cases like that. We have to take special consideration and work with them uniquely based upon what they're able to do within their spine, because if you have a couple of segments that are locked and fused together surgically, then we got to treat your spine differently than your freely movable. Now, in some cases, surgery is absolutely necessary, and we know when we can track that and when to guide people to wind up getting it. If you've had spinal surgery, make sure that you wind up getting your spine checked to see how the alignment of those segments have been made. If you're wondering if you're a candidate to get help with corrective chiropractic care, go ahead and write down below. We'll look to help you find someone who can get the help that you need. If you've got more questions, go ahead and write them down below too. We'll do our best to answer them. And if you want specifics on yourself, let's hop on a discovery call. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.